ill or well snapshot. When you enter the OSCE station, you need to know if your patient is acutely ill or he is well. If the patient is looking ill, for example, if the patient is looking pale, if the patient is looking drowsy or lethargic, the first thing I do is I ask the examiner or I look for vitals of the patient. It is important to know why we need to do that. The reason we do that is we need to save the patient. If the patient's vitals are low, we need to start fluids. And if the patient oxygen saturations are low, we need to give the patient oxygen and then start taking history. So it's important when you go into the room, make sure you use the ill or well snapshot where look at the patient. If the patient is appearing unwell or ill, make sure you do what is important. I usually ask the examiner or look for the vitals. And if the vitals are abnormal, I fix that and then start taking history from the patient. This is part of my OSCE mastery coaching system. So if you would like to know more about it, and if you would like to know the system where I teach the 5 pillars to be a successful clinician or pass your clinical exams in your first attempt, then look for a link under this video or in the bio, and I will see you in that video.